Tonight, for the first time, we are taking you inside a local ICU in the front lines of the COVID-19 pandemic. At the start of the year, Caldwell UNC Healthcare's parking lot was the site of a Samaritan's Purse field hospital as the area saw a surge in COVID-19 cases. WCNC Charlotte's Brandon Goldner spoke to the Lenoir Hospital's leadership, who's crediting monoclonal antibody treatments for preventing a similar wave of patients.
This is the heart of Caldwell UNC Healthcare's ICU. Nurse Crystal Cannon prepares to go into the room of a COVID-19 patient. Life in the ICU is tough.
Crisis alarming, warning.
It was only last winter when we toured a field hospital set up next to the main hospital's helipad. The mountains and foothills were buckling from a surge in COVID-19 patients who needed to be hospitalized.
All right, now I'm on full regard.
But now hospital leaders say it's gotten more manageable, as doctors here prescribe more monoclonal antibody treatments to COVID-19 patients.
They're similar to taking a wad of chewing gum and throwing it in the spokes of a bicycle. It kind of gums up the virus so that it can't attach to human cells.
Chief Medical Officer Dr. David Lowry says these outpatient treatments are used for COVID-19 patients who aren't sick enough to be in the hospital but are at high risk of ending up in the ICU. He says since last November, they've given more than 1,600 doses, 1,100 of those doses given since August 1st. And he estimates the treatments prevented dozens of people from being hospitalized.
For example, this morning we have about 29 or 30 patients with COVID in the hospital. Had we not been giving monoclonals, that number might be 40. That would really stretch us.
Even just to handle the monoclonal antibodies requires full donning of PPE to protect the antibodies and keep them sterile. Using these antibodies requires a specific set of procedures, and Dr. Lowry says antibodies are most effective early in the virus's progression.
So it's important for people to get tested as soon as they develop symptoms.
And he says it's just as important to get the COVID-19 vaccine. In Lenoir, Brandon Goldner, WCNC Charlotte.